Today's video is all about a common nighttime nuisance that many of us have experienced: nighttime dry coughs. If you've ever found yourself tossing and turning, struggling with a persistent cough that seems to intensify after the lights go out, you're not alone. But fear not, because in this video, we'll be exploring the ins and outs of nighttime dry coughs and sharing some practical strategies to help you get a more restful sleep. This exploration delves into 10 such strategies, offering insights into their significance and how they contribute to mitigating the discomfort associated with nighttime dry coughs. Nighttime dry coughs, in the context of this video, refer to the disruptive phenomenon of experiencing a persistent, non-productive cough primarily during the night. This type of cough is characterized by throat irritation and a dry, scratchy feeling without the presence of mucus. Understanding the specific challenges posed by nighttime dry coughs is crucial for implementing effective strategies to manage and alleviate this nocturnal discomfort, ensuring a more peaceful and undisturbed sleep. Let's jump right in. Number 1. Stay hydrated. Staying hydrated is crucial to alleviate a nighttime dry cough. Adequate water intake keeps the throat moist, providing relief from irritation. Hydration is especially important during the evening to counteract the potential drying effects of breathing through the mouth while sleeping. Sipping water throughout the day and having a glass by your bedside can be beneficial. This simple yet effective measure helps soothe the throat, lessen coughing episodes, and contributes to overall respiratory comfort during the night. Maintaining optimal hydration is a foundational step in managing dry coughs and fostering a conducive environment for restful sleep. Number 2. Humidify the air. Using a humidifier in the bedroom is a valuable strategy to combat nighttime dry coughs. The device disperses moisture into the air, preventing the throat from becoming excessively dry and minimizing irritation. Especially beneficial in dry climates or during winter when indoor heating systems reduce humidity. A humidifier helps create a more comfortable sleep environment. Moist air can ease respiratory passages, reduce coughing, and promote better sleep quality. Regular use of a humidifier is a proactive approach to maintaining optimal indoor humidity levels, providing relief for individuals prone to nighttime coughing due to dry air conditions. Number 3. Elevate your head. Elevating the head during sleep emerges as a practical remedy for alleviating nighttime dry coughs. Propping up the head with an extra pillow or slightly elevating the bed's head can mitigate the effects of postnasal drip and reduce coughing episodes. This elevation facilitates better drainage of mucus, preventing its accumulation in the throat that often triggers coughing, especially when lying flat. By promoting a slight incline, this simple adjustment supports respiratory comfort, minimizes throat irritation, and contributes to uninterrupted sleep. It's a non-invasive, easily implemented method to manage nighttime coughs, enhancing overall well-being and the quality of sleep. Number 4. Avoid irritants. Avoiding environmental irritants is pivotal in addressing nighttime dry coughs. Identifying and steering clear of factors like tobacco smoke, strong odors, or allergens can significantly diminish coughing episodes. These irritants can exacerbate throat sensitivity and trigger cough reflexes, particularly during the night when the body is in a more relaxed state. Creating a clean and allergen-free sleep environment becomes essential for respiratory comfort. Taking proactive measures to minimize exposure to such triggers aids in managing and preventing nighttime coughing, fostering an atmosphere conducive to restful sleep and overall respiratory well-being. Number 5. Use throat lozenges or hard candy. Utilizing throat lozenges or hard candy serves as a soothing remedy for nighttime dry coughs. These items promote salivation, keeping the throat hydrated and alleviating irritation. The act of sucking on a lozenge or candy provides a comforting sensation, temporarily suppressing the urge to cough. Many of these products contain ingredients like menthol or honey, known for their soothing properties. This simple and accessible solution offers quick relief, especially when the cough is triggered by throat dryness or irritation. Incorporating throat lozenges or hard candy into bedtime routines can contribute to a more peaceful night's sleep for individuals grappling with nocturnal coughing. Number 6. Warm saltwater gargle. A warm saltwater gargle is a time-tested remedy for nighttime dry coughs. Mixing about half a teaspoon of salt in a glass of warm water creates a saline solution that can help soothe a scratchy or irritated throat. Gargling with this solution provides a mild antiseptic effect, reducing inflammation and easing discomfort. The warmth of the water also contributes to relaxation. This simple yet effective home remedy can be incorporated into pre-bedtime routines, offering a natural and cost-effective way to alleviate nighttime coughing and promote a more comfortable sleep experience. Consistent use may enhance throat health and minimize irritation over time. Number 7. Over-the-counter cough medicine. Over-the-counter cough medicine can be a valuable option for addressing nighttime dry coughs. Formulations containing dextromethorphan, an effective cough suppressant, help alleviate the urge to cough and promote a more restful sleep. However, it's crucial to adhere strictly to recommended dosages and guidelines, as misuse may lead to adverse effects. Consulting with a healthcare professional before using these medications is advisable, especially for individuals with underlying health conditions or those taking other medications. While providing symptomatic relief, over-the-counter cough medicines should be seen as part of a broader approach that includes identifying and addressing the root causes of the cough. Number 8. Identify and treat underlying causes. Identifying and treating underlying causes is paramount in addressing nighttime dry coughs. If persistent, the cough may signify allergies, sinusitis, or acid reflux, among other potential triggers. Consulting a healthcare professional for a comprehensive evaluation is crucial to pinpoint the root cause and tailor an effective treatment plan. Allergies may necessitate antihistamines, sinusitis may require decongestants or antibiotics, and acid reflux may benefit from dietary changes or medications. A thorough assessment ensures targeted interventions, addressing the specific issue and providing long-term relief. Ignoring persistent symptoms may lead to complications, making professional guidance essential for effective management. Number 9. Avoid eating before bed. Avoiding large meals or heavy snacks close to bedtime is a prudent strategy to manage nighttime dry coughs. Eating before bed can trigger acid reflux, contributing to throat irritation and coughing. When lying down, stomach acids may flow into the esophagus more easily, exacerbating reflux symptoms. Opting for lighter, easily digestible meals and allowing a few hours between eating and bedtime helps reduce the risk of reflux-induced coughing. This dietary adjustment complements other nighttime cough management strategies, contributing to a more peaceful and undisturbed sleep. Consistent adherence to this practice can positively impact overall respiratory comfort during the night. Number 10. Stay consistent with sleep hygiene. Maintaining consistent sleep hygiene is pivotal in managing nighttime dry coughs. A regular sleep schedule and healthy sleep habits create a conducive environment for optimal rest. Prioritizing a consistent bedtime routine signals the body to unwind, promoting relaxation. A well-rested body is better equipped to cope with respiratory irritations that may trigger coughing. Additionally, creating a comfortable sleep environment, free from disturbances and optimized for relaxation, contributes to overall sleep quality. Combining these practices with other cough management strategies enhances their effectiveness, fostering a more tranquil night's sleep and supporting the body's natural mechanisms for recovery. Summary: Nighttime dry coughs, marked by persistent throat irritation without the presence of mucus, can significantly disrupt sleep and impact overall well-being. This exploration focuses on 10 effective strategies for managing and alleviating these nocturnal coughing episodes. From staying hydrated, using humidifiers, and elevating the head during sleep to avoiding environmental irritants and employing throat-soothing measures, each approach plays a crucial role in creating a conducive environment for restful sleep. Additionally, addressing underlying causes, maintaining consistent sleep hygiene, and considering over-the-counter remedies contribute to a comprehensive approach in managing nighttime dry coughs, enhancing respiratory comfort and promoting a more tranquil night's rest. Thank you for tuning in. If you found this video helpful in managing nighttime dry coughs, don't forget to give it a thumbs up and hit the subscribe button for more health tips and lifestyle insights. If you have your own remedies or experiences to share, please drop them in the comments below. Let's create a community of support. For more valuable content, check out our related videos on maintaining a healthy lifestyle and improving sleep quality. And remember, a good night's sleep is essential for overall well-being, so take care of yourself and prioritize your health. Until next time, sleep well and stay healthy.